Hi, Hugh.
Hi, it's Taz, is it?
Yeah, great to meet you.
Nice to meet you, Taz.
Come on in. I heard you're interested in research.
Yeah, I'm not sure how to get involved.
Well, you come to the right place.
Okay.
So your physician will obviously look at your medical history and has decided that you're eligible for certain studies. And to start the process, you're meeting with someone like me who's a research professional.
Yeah.
And what we do is we walk you through all the details of the study.
Okay, so what am I getting myself in for here, Taz?
So a key part of any clinical research is something called informed consent. So
Yeah.
this is where we give you all the information, we present you with a document called informed consent document.
Is that a big one?
It's a little big one. It is reviewed by the research ethics boards. Their job is to kind of safeguard your participation, to say you're protected while you're in the research study.
Okay,
so
so
that's
it's to protect me then.
Yes, it's there to protect you and also give you all the information. So this form that we will work together with, it will have things like, what the study is about,
Yeah.
how long you're going to be in the study for,
Okay,
any
yeah.
kind of risk and benefits, and we'll sort of walk through all of the details together.
Yeah.
And gives you lots of opportunity to ask questions so until you can decide if this is the right study for you.
Okay, does it cover confidential information? Like, I'm not sure I want my name out there and on the web or anything like that?
Oh, yes, it's absolutely, it's all, the confidentiality is all laid out in the consent form. So your name will only show up in the form when you sign it.
Okay.
But after that, you'll be given your own sort of subject ID, which is like a random ID.
Yeah.
And all the study data will have that ID, not your own name. So we'll maintain that confidentiality.
Okay, you mentioned something about risks. What kind of risks are you talking about?
So all research studies may come with some risk. So depending on the study procedures, some of it could be big risk, some of it could be very little.
What's a big versus a little?
So, like for example, some studies have blood draws. So if that obviously
Okay, so that sounds like a
involves
little.
Needles.
What's a big one?
Big one could be, there's an MRI. Some people could be quite claustrophobic.
Ooh, that's me.
Yes.
So are there really low risk kinds of studies? What kinds of studies are there?
That would be things like, questionnaires that ask you about your symptoms, how long you've had your symptoms. So more
Okay, so-
questionnaire based that can, just take up some time.
Okay, so I've done a few of those, so that's no big deal. That's good. And do I get my results?
Yes, so some studies
I want to know my info, right?
Some studies do give those results, and it can also be given to your family doctor. Most cases, though, research studies are sort of combined. So all the results from all the participants are put together,
Yeah.
and then we do some statistics on it, and that's the results that is provided to the patients.
And so I get this bunch of statistics and stuff. How do I know what that means for me?
Well, it will be in a plain language. To
Okay.
be understandable. So, for example, if it's a treatment study, then this will show how much most of the patients improved by.
Okay.
Yeah.
And do I get to have the treatment after the study's over?
Again, that is something that will be highlighted in the consent form. That
Okay,
we
so
will
back
go,
to the consent form
yes.
then, yeah.
So that document is basically highlighting everything about the study. So even
Okay.
after you've signed the form, which is not legally binding, meaning you can leave at any time. So you can withdraw at any time, and you don't even have to give a reason, and it's not
Okay.
going to affect your care.
That's
all.
all right. What about the drugs I'm on right now and the medications I'm on? Do I get to stay on them?
In most cases, yes. So again, if for some study procedures they want you to be off those medications,
okay.
it will be laid out and you will know.
So you've been all these research patients. Do they come back for more and come again?
Always.
Always.
Yeah, no, I'm joking. Most cases, yes, patients
Really?
do. If they have, we try to make sure that they do have a good experience.
Yeah.
And of course, if there's some issues, we like to work it out. We try to work with your schedule in terms of visits, because some of them do require more time commitment.
Okay.
But we do like to make sure that patients do come back. They go out there, talk about the study with other patients as
Yeah.
well, because we can't move research forward without more participants.
Yeah, that's interesting.
All right, Hugh. So if you don't have any more questions, I'm going to send you some consent forms for some studies, and I want you to take as much time as you need to go over the consent form with your family, your friends, and then pick a study that fits you. And if and when you're interested in participating in any of the studies, you give me a call, and we'll get you started.
Okay, if I have any questions about the form, do I call it? What do I do?
Absolutely. As many questions as you have, you can always contact me. I'm here to answer all your questions until you're fully satisfied, and then you're ready to proceed.
Okay, it's really nice to
Nice
meet you.
to meet
Thanks.
you as well.
Okay, I look forward to hearing from
Look
you.
forward to seeing you in the study.
Okay.